Good afternoon, everyone. Welcome. Very excited for this presentation. We're going to give a couple of minutes grace period and then we will get started. Thanks so much. All right, good afternoon, everyone. I'm very excited for today's webinar. We have the wonderful Nicole aBeckett from HeroGeneration, and this platform that she created based on her own experiences as a caregiver is really an incredible story. So I'm going to pass it over to her to share some different tech platforms that might make your life easier as a caregiver. And stay tuned for the very end. There will be a special treat from HeroGeneration. So over to you, Nicole. Thanks so much.
Great. Thank you, Bree. And hi, everybody. Thank you so much for having me. I have been in your shoes as a caregiver, and I'll share more about my story. But really, it was being in those shoes that I realized we needed more support for caregivers who really are the backbone of supporting our loved ones when they're out of the hospital, when they're in the hospital. And that led me to create HeroGeneration and then really step into this bigger ecosystem of caregiver technology. So I'm really excited to share with you today just what we see overall in what's being done to support caregivers and how it can augment the amazing work that family caregivers are doing. So I'm going to go ahead and share and get started. So as I go through, I just want to invite anybody to ask questions, raise your hand, in the Zoom hand raise, or feel free to, unmute if you can, and ask questions throughout. We don't need to wait until the end. I will have time at the end, of course, for Q&A, but please, I want to make this as interactive as possible. If you have any questions or comments, and if you've used some of these, please feel free to interject and give your experience. I also want to say, as I go through, I'll mention some different products and companies. I in no way am endorsing these. These are just ones that are out in the marketplace that have kind of risen above. And so feel free to test them out on your own. And anybody who has input, I'm happy to hear it. So with that, let's get started. So a little bit about me. I have been a caregiver for both of my parents. My journey started a long time ago. My dad was diagnosed with cancer and he lived with it for about 15 years. And my mom was his primary caregiver, but I definitely supported. They were in Los Angeles. I lived in Los Angeles. So I supported as much as possible. You'll see this is when I came home with my first child, and my dad was pretty much in the late stage of his cancer battle, and he passed about 6 weeks later. So, it's a nobody can plan for any of this, right? This comes at you when it comes, and you have to be able to navigate emotionally, physically, all the things. And so that was, the start of my journey deeper into caregiving. My mom had long, lived with a lung disease called interstitial lung disease. And shortly, soon after my father passed, it really took a turn and became more demanding on her and her life. And then, of course, my life as well. And I supported her as the primary caregiver for about 5 years. And my mom passed in 2021. So I come from a background of startups. I've worked in tech and startups for over 20 years. And at the time, with both of my parents, I was looking for something that could really support me and keep everything organized. And, I have a big family and they all wanted to help. And it just wasn't easy to bring them in to help me and think of things that they could do. And, all the information I was getting from doctors and palliative care versus hospice care, et cetera, it was all, coming in fast. And I had no place to really lean on for questions. I was in my early 30s and none of my friends were going through it at the same time. I didn't have that community either. So, I feel like I went through that journey alone. And now having built my company and again, seeing that there were so many resources out there, I just didn't have a good way of finding them or coming upon them. And it made me want to focus on building a platform that could bring all those resources together, bring in community, bring in collaboration tools, and build just a better pathway for caregivers that are on that journey. And so I will go into that a little bit more, but I think, now having been in it for a couple of years, just seeing the incredible work by a lot of companies, we have a lot to look forward to and to make our lives a little bit easier. Just to kind of level set, I know we all know the challenge of caregiving because we're in it, we're living it. But I like to always just when I talk, just level set, so we're all kind of really on the same page about the magnitude of the caregiving challenge. Recent data just released by AARP, National Caregiving Alliance, caregiver numbers have jumped significantly. It used to be 53 million. It's now up to 63 million Americans are providing caregiving, unpaid caregiving. So these are not paid caregivers. This is family caregivers supporting a loved one, whether that's an aging parent, a spouse, or a child with special needs. That is a very big number. And 60% of those are juggling work. So we know the ramifications of all of that, where you start to miss work, absenteeism, you start to contemplate leaving the workforce altogether, and that just tumbles into the financial aspect of it. Already caregivers are paying over $7,000 out of pocket, then having to leave the workforce or step back from the workforce. It really is a spiral effect that affects so many people and so many aspects of our lives. And, one of my least favorite statistics are the clinical signs of depression that caregivers face. I mean, we're taking on so much of the load, but it's weighing on us so much. And, if there's one statistic that I want to really focus on and turn around, it's the one about depression, and really focusing on giving caregivers space to be their full selves and not let this journey, because it is a heavy journey. It is a heavy journey, but there are pathways to make it easier and to find joy where you can, or see it for what it is in terms of a beautiful relationship. And so, I just wanted to focus on that one. And as we move forward, just think about how we and how tech can really support that statistic of ending depression, anxiety, or at least minimizing it a little bit more. I always like to show this because I think it really puts into perspective what a caregiver does on a day-to-day basis, really. And this is an actual social media post from one of the caregiver groups. And it's about a woman who's preparing for her mom's hip surgery in the coming week. And she lists all the things that she had to do, set up the shower bench, wheelchair ramps, get the Netflix account, prepare for groceries, make doctor's appointments, follow-up appointments, et cetera, et cetera. And then she shows the text exchange with her sister. It's like, by the way, mom's having surgery next week. I've got it ready. And the sister says, "Oh, great. What was that surgery again?" So I think it just really contextualized how much caregiving usually falls on one person. And the more we can start to offload that in ways to bring in other people into the journey, again, it just really relieves all of the pressure and stress that falls onto caregivers. So let's get into it. What is caregiver tech? Well, at the end of the day, it's really anything that makes your life easier. It's what it should be, actually. Um, I think, the tech landscape, caregiver tech landscape has really exploded in the last 5 years, and not just for in the hospitals and gadgets and such, but really stuff for in the home, for your kitchen table, for you in your living room, for your loved one. We're seeing an ecosystem of solutions that are really built to make caregiving a little bit easier and more connected, and ideally more human. So all of these categories, which I will definitely go into each one individually more in depth. I think the main thing to remember with all of them is that caregiver tech is not going to replace humans, but it can amplify the work that we all do. And so just keep that in mind as we go through each one of these categories. All right, so the first care tech category that I am focused in on are the coordination platforms. And really, this category really helps bridge the communication gap that often causes a lot of confusion and burnout. You're trying to manage not just the care of your loved one, but a lot of maybe like siblings or family, friends who want to be supportive or want to hear updates. They all want to stay on the same page. And I like to say caregiving is like death by a thousand cuts. It's just one thing after another. Like we mentioned in that post, getting groceries, doctor's appointments, picking up medications, refilling medications, managing medications, et cetera, et cetera, et cetera. And, it just all keeps piling up. And so what care coordination platforms really aim to do, and HeroGeneration, my company, is one of those, is really to spread the responsibilities, bring in more people easily. So they do that by, you can invite team members by email or by SMS. They come in, they can see information that needs to be seen. You can share to-dos. So let somebody go get the groceries. Let somebody else go pick up the medication. Maybe somebody can help with transportation to the doctor's appointment, or, talking a little bit down the line, maybe now a lot of appointments can be done through telehealth. And so maybe you can't be there, but somebody else can be there to help set it up, have them help on that. And you can come into the telehealth meeting as well. So all of these ways to coordinate, these platforms really are supporting bringing other people into the journey, so that that one person that we saw in the social media post doesn't have to handle everything all on their own. And it's just an easier way to offload and bring in those people who say, I want to help. How can I help? It's not always easy to say like, oh, I can't think of anything right now, I'll tell you later. And then you forget to tell them. And, this should make it easy to list all your to-dos, assign them to folks, or make a note, like Caring Bridge. It's really great of doing updates, and lots of helping hands. You bring in a care team as well. It's HeroGeneration, my company, also has both of those abilities. So again, it's just really encouraging collaboration across the board and supporting your loved one. Okay, the next one. So remote monitoring and safety tech. So these are things such as wearables, sensors, voice assistants, and really the purpose of these is to remote monitoring, safety and technology. The purpose is really to give caregivers peace of mind when you can't be there all the time, right? Again, going back to that statistic of working, 60% work. You are nervous. You're living with that daily anxiety. Have they fallen? Did I get should I text them? Should I call them? And a lot of these new technologies can help monitor, if they see that a fall, or, somebody hasn't gotten up from bed, in the morning or so. Like, it just gives you peace of mind to know there's movement. And we have so much great technology to be able to relieve a little bit of that stress and anxiety. And so, Alexa through Amazon, they have a really great caregiving platform called Alexa Together. and Care Predict, it really, as you can see, this one is Care Predict. It really shows if your loved one is getting up, if they're moving around, if they haven't moved in a while. So really, actually, this is Care Predict, and that has a lot of data just to show kind of like daily activities, and maybe you can adjust caregiving, your own caregiving, or if it's a paid caregiver, according to their daily movements. And again, this should not be thought of as surveillance, because of course that comes into play. Older adults especially are still autonomous. Some of them, depending on the condition or so, they're autonomous adults. They don't want to be monitored 24/7. And so there's different levels of check-ins. Some platforms will just send a daily text for you to your loved one, and if they respond, great, just so they know, hey, I'm just checking in. And it really, that all starts with having conversations with your loved one, coming from a place of, look, I just want to have peace of mind. I love you so much. I want to have peace of mind that everything's okay, and if I need to get more involved or so, then I will. But this is just a great way to start, especially if your loved one is still living on their own, or in another state.
Just popping in to let you know we have a couple questions. So
Okay,
first
great.
one is, will we get an email with the platforms mentioned? You'll get a follow-up email with a recording of this webinar, which has all the platforms in it. And then you'll also get instructions on how to access HeroGen for free for a year. I don't know if you want to add anything else.
No, yeah, absolutely. And yeah, I think this will be recorded, so they're all there for you to check. Yeah, everybody can check them out on their own.
And then the second question we have is how to deal with my husband who has vascular dementia and you have no family. Since I'm in a Medicare Advantage plan, I get little or no help.
Yeah, these are definitely tough, situations. And I think, going to organizations, particularly like Lisa's Care Connection, going to organizations like Alzheimer's Association, all of these groups that really exist um, to support people caregiving for loved ones, particularly with dementia, particularly with Alzheimer's. There are a lot of resources out there. I think also regional centers, you know, it's may not be on the first try that somebody has the resources that's right for you, but respite care, a lot of organizations exist to support exactly your situation. And I think it's just connecting with people, talking through, seeing what programs are available. In HeroGeneration, as Bree mentioned, which I'll let the cat out of the bag now, but we will be offering HeroGeneration for a year free to Lisa's Care Connection members. We have a digital care assistant named Ask Andrea, and you can ask her. She's named after my mother, actually, but you can ask her questions of, here's my situation. What organizations exist in my area, depending on where you live, and they will come up with organizations for particularly, or Andrea will provide you a list of organizations. And I would just start there because, as I mentioned, with my situation, I didn't know what I didn't know. And this is what led me to create HeroGeneration. But there are so many organizations out there that want to support you. And I think it just starts with having those conversations. And again, this goes back to the human interaction piece of it. Calling people, talking through your situation, and, finding the resource that supports you.
That is so well said, Nicole. And I highly encourage anybody who hasn't already or who hasn't in a while to connect with us at Lisa's for a care consultation. We'll assess, all of your benefits, help you get connected to low and no cost resources. There are respite grants. And then we also offer support groups. It's really vital to be around other people who understand what it's like, who are going through it concurrently. And we even have this really wonderful program called Hugs that's a peer-to-peer mentorship program. So while this person may not be blood family, they can become like family and really be a go-to person, so the entire challenge of caregiving doesn't fall on you.
100%. That's amazing. That right there is so helpful and beneficial. And again, that's, again, this is the intersection of the human and the tech augmentation. It's not going to replace that one-to-one connection. So it should enhance where we start by having those conversations. And Lisa's Care Connection is such a great starting point for supporting you. Okay, so just to keep going. All right, health management apps. Again, these are really to support those of you managing healthcare. I know with my mom, I was particularly towards the end, she had a subcutaneous pump. So it's like a pump that she wears 24 hours. I was changing it out every 2 days. I was titrating. I am a startup founder. I am not a medical professional. It was a lot, but knowing that there are platforms to monitor medications, so things like med trackers and Medisafe, PillPack that was purchased by Amazon, CareZone, all of these that if you have a medication bottle, you can take a picture of it. It will take that information from the bottle and put it into a medication tracker, so you can see, okay, what needs to be taken on which day, and that really supports you, because when we start getting up into 10, 15, different medications, it's just such a heavy, mental capacity that it takes on for you. And some of these health management apps can really, start to offload some of that capacity that you're having to carry in your brain. Others do vitals. So you're checking blood pressure, or it's monitoring, when you put in the blood pressure, daily blood pressure, and, maybe something starts to go up or so. And so, it's just really helpful to keep track, rather than, again, in your mental notes or on a note, in your phone, or writing it down or so. It just can not only receive the information, but start to analyze that information as well. Okay. This is a really important one, I think. Financial and legal tools. We're not just healthcare providers. We're paper pushers, right? We are, as caregivers, we're doing so much paperwork. We're monitoring so much paperwork with insurance, with legal, financial, budgeting, et cetera, trying to keep it all on track. And financial and legal tools can really help get things in order, so you have, again, peace of mind. Powers of attorney, wills, trust, all of it. It really helps you get organized, track expenses. Also, one that I find really interesting from Careful is that you or your loved one, again, depending on what stage they're in, maybe they receive an email or they receive a text that says, like, you have a package at the post office. You have to send us $5 for the tariff and we'll release it. Things like that they receive, they can put it into the scam check from Careful and really see, is this real? Is it not? Because, they're getting really sophisticated these days. Even I sometimes get some messages and I'm like, I don't think this is real, but that's a really good one. So there are a lot of tools out there, again, to support caregivers, just maintaining organization. And because having been through it now twice myself, knowing, especially when it gets towards the end, emotions are just really, really heavy and really high. And to then have to go through the issues of financials, finances, probate, all of that, it's just a really unfortunate, after you've gone through all this emotional weight of caring for your loved one, to then have to do everything after the fact. If there's anything we can do to pre-prepare, it just makes that journey so much easier and really clears up the pathway of the journey to spend time with your loved one, rather than, feeling that emotional weight of getting affairs in order later, when you're not, not really wanting to focus on that. You want to focus on your time with your loved ones. So a lot of these, like trust and will, just getting at least getting understanding of what is needed rather than maybe going through. I really still recommend working with a lawyer, and there are some that will do some pro bono work, again, through organizations or at very, very low costs. These apps as well, because they're using a lot of automation, their services can be less than traditional lawyers, but I would still have a conversation face to face with a lawyer as well before moving straight through just to the tech. But again, this just gives you a good space to understand what might be needed. Okay. All right, so I'm in front of a window and the sun's coming straight into my eyes. So I'm just gonna there we go. Okay. So this is a big one. I'm sure everybody has heard about AI companionship, the power and quite frankly, the unknowns about AI companionship. I would really recommend, taking it slowly with AI. I did want to put some on here because you can't ignore it. It's out there. There are, AI companions can be there when you can't be, because it can be a lonely place as you get older. You do want some sort of interaction. And some of these platforms are really good about just talking about, maybe you have a favorite, your loved one has a favorite music station or sports or so, and they will interact on that. And it can be very, very fun. They can also offer reminders and a sense of presence that just really eases isolation. And for you as the caregiver, again, it's just peace of mind to know that your loved one is not alone. I know with my mom, this was before all of these tools. I struggled with that tremendously. The guilt of always feeling like I should be there. I should be there instead of doing this thing that I'm doing. And so this can really offer some interesting ways to have some interaction during the day, or when you're working or when you can't be there, you need to step away for a little bit. It really is one of the hopeful frontiers, I would say, for caregiver tech. I think, we should be closely monitoring it. It's not something to dive into and it's going to replace human interaction in any way, but it can definitely fill some of those quiet gaps in some interesting ways. And so, I think LAQ, I really find them interesting. Memory Lane, which was, I think, acquired by Amazon as well. One I added on there actually, which is not AI, but it's more for emotional support, and it's one that I used, was StoryCorps. And some of you may be familiar with that through NPR, does a lot of stories with StoryCorps, but I used it with my parents, where I recorded their life story. And it was really lovely, even at the time, to go through it with them and, just hear sort of their upbringing and then also things that they wanted to share and leave with, my family, my children. And I go back to it every once in a while. And what's interesting with StoryCorps is they're accumulating all of these stories across, from millions and millions of Americans. And they may use them in different ways just to augment like a historical story or so. You can hear it on NPR once in a while, but also you can keep it private if you don't want that piece to it. So it's a really beautiful way to record talking with your family and your loved ones, and then have it really in perpetuity. I know I'm very grateful to have that. So I wanted to add that in there as well. So yeah, I think that this is a very interesting space and some really interesting tech going on. And there are a lot of platforms in this space. Look at the founders' history. If they're coming from it from a personal perspective, it adds a little bit more authenticity to what the platform is. But again, there's a lot of different perspectives in here that can really help with interaction with your loved one throughout the day. And so it's a very, very interesting space to see growing. Okay, so this is on employer-focused caregiver support tools. So I think, employers are really starting to see that caregiving is a workplace issue. It's not just for you to handle on your own after hours. Clearly, as caregivers are really becoming de facto healthcare professionals, it's really affecting folks in the workplace. And they, say what we will about our employers, but I come from a place of, they really do want what's best for you, and what's best for their employees. And so they're trying to incorporate some of these tools. And if you don't have any caregiver tools, that may be something on surveys. If you work for companies that do surveys, that you can, mention to them as potential additions to your workplace benefits. Things like Wealthy, where they have caregiver concierge services, but you already get that through Lisa's Care Connection, so that's really wonderful. Torchlight, they do a lot of full service, again, giving you collaboration tools and management, as well as some other caregiver concierge services, Carry Loop. These are all ones that are really focusing on the workplace and working with employers to make their employees' benefits be supported. And so again, this is something that you can mention to your companies, and really the more we talk about it and bring it into corporate culture, the more widespread caregiving resources I think will become. And we've definitely started to have conversations with employers about HeroGen in their workplace. And they say that they're seeing it a lot more and more in terms of requests from employees, but also that it's a problem that needs solving in their workplace as well. And I'll just quickly give a little plug that on our blog, we have a Caregivers in the Workplace toolkit that really gives a lot of good information and conversation starters. A lot of times, I think the data is something like only 20% of managers know if their employee is in a caregiving situation. And it just shows that people are afraid to tell their employers. And, that's unfortunate, because I think, the more we can share and talk about it, the better our workplaces become, and really, society in general, so that we're recognizing the role of the caregivers in the workplace. Okay, last and certainly not least, probably the most important, are self-care tech for caregivers. And I'm preaching to the choir here, I know. And caregivers, we're giving constantly, and we're often, coming from an empty cup. I, always talk about when I was caring for my mom, I felt like I was in a washing machine, just tumbling. I couldn't get a hold of control of myself or anything that was going on in my life. I was just tumbling through. And, again, I didn't take time to focus on me. And I really wish I had more of that space or more of that inclination to do so. And so I think just as we look at some of these and highlight some of these caregiver self-care tech, it can be something that we all put on the back burner. We don't make space, or, this isn't the most important thing, but I'm sure you've all heard it. We have to focus on ourselves, and things like mindfulness. Headspace has a great caregiver meditation series. We have a meditation series for caregivers on HeroGeneration. Headspace has a full spectrum of mindfulness, meditation, breathing, breath work, lots and lots and lots of great resources. Some of them free for caregivers. And, I think anything we can do, even for 10 minutes, 5 minutes, to relieve the stress is important. I still think getting outside and taking a walk is one of the best stress relievers, but you can do that while listening to a meditation, right? And just really enhance what you're doing outside. Sleep and recovery, having an Apple Watch that tracks your sleep. A lot of people use the Aura Ring. a lot of that just to show like, you probably know your sleep is not great, but when you see it in data, when it says, Nicole, you only got 4 hours of sleep last night, it really kind of highlights and maybe can push it to the forefront for your own therapy, your own priorities. And I think I put Facebook on here, and for some of us, Facebook spikes anxiety. I get it. Same. But there actually are a lot of really great groups that are monitored really well for caregivers. And so I have found that that is one of the best uses of Facebook, and really the only use of Facebook that I have right now is finding different groups. And you can find groups for your condition, maybe for your location. And they really do, you can see right away which ones are good, which ones have strong monitors who are making sure the content is positive, is helpful. And so if you're not already looking at those Facebook groups, I would encourage it as just, again, an addendum to the virtual groups that Lisa's Care Connection does or other groups may do, because they're there 24 hours, and it's good to kind of go through and just see other people's perspectives. And so, yeah, so that's the peer connection patch. All of these BetterHelp is therapy. And again, therapy is just being able to talk to somebody. Oftentimes they have some free resources as well, in addition to paid resources. But this is a tough role that nobody is usually prepared for. And so encouraging everyone to speak to somebody about it, a professional about it, is wonderful. And again, going through Lisa's Care Connection to find those resources, or online, there's a lot of access out there, and it would just be another encouragement. But at the end of the day, my biggest takeaway from this is find space for yourself. Of course, find a way, that something that brings you joy, that you carve out, you set a boundary. These are my 30 minutes to an hour of a day, 20 minutes, whatever it may be, that I'm going to carve out for me. And it just fills your cup, replenishes your soul, and gives you more space to go into the caregiving journey that needs to be done. Okay, so those are all the categories, and I'm sorry, I don't see the, so Bree, please step in if there are questions again. I don't see that if they pop up.
I don't see any more questions currently. A few may trickle in.
Okay.
I'll let you know.
Okay, I can keep going. So, there are huge opportunities with caregiver tech, of course, big potential. There are some challenges as well. Biggest opportunity is that it can just personalize support. Instead of, these days now Googling for answers and finding an article from a few years ago that talks about your issue, really through AI and different data, you can really target support specifically for you and adapt to your needs, your family's needs, your loved ones' needs. I'm very hopeful that it can ease burnout by taking over repetitive tasks or helping caregivers bring in other people to the team. That's really what we focus on at HeroGeneration, bringing in other people into your team so it's not all falling on one person. And caregivers have more time to focus on being present with their loved one and that relationship with the loved one, which will bring so much more richness to the caregiving journey. Also, it's just, there's a lot of information out there from, when maybe your loved one is discharged from the hospital, or there's an incident. There's just a lot of information that can now be synthesized and help other people, again, come into the team and stay informed, and really just ease the care journey for everybody. Also, depending on where you live, you may not live in a really big metropolitan area. You may live in rural areas. It can bring a lot of caregiving resources or support resources to folks who aren't as in, highly populated areas. So, that's really hopeful for folks that, may be more remote, or your loved one, you live in one state, your loved one lives in another state. A lot of this tech and like monitoring, especially, and collaboration tools can really help folks be part of the journey who or be part of the support system, not just the journey, but really can support who may be remote or living in far away. So that's really great from where we were just 5 years ago, honestly. But there's hurdles, of course, there are hurdles too, and challenges. And, of course, all of these have costs. Creating new tech and platforms can be expensive. And so, I'm hopeful that as we are with HeroGeneration and partnering with different organizations, all of these platforms have programs that can make it accessible, or maybe they work with nonprofits or local governments. So I would say if you see something that looks like it's right for you, but maybe you're not able to, it's not in your budget or so, reach out to the company and ask if they have programs, ask if they have partnerships, or reach out to a nonprofit, let them know, that you see something that could be helpful. I know that especially for me and others in the ecosystem, we want to make our, tools as accessible as possible. And we're always willing to look at different ways to make that work. So, so that's a challenge, but I think that can, people are willing to work together to overcome it. Also, of course, privacy concerns. I would, make sure for everybody, make sure that you're looking at data privacy policies or ensuring that it's HIPAA compliant or so. Luckily, a lot of states are putting in really rigorous standards for private health data. Washington State having the highest and strictest standards. And I know those are the standards that we adhere to and we go by. And so really just kind of make sure that any platform that you're looking at does have language that shows that they are protecting your data, they have security, encryption, et cetera, because it's very important. The last sort of challenge I would say is that I just presented probably 20 to 30 apps, right? Or 20 to 30 platforms. And so there's a lot of fragmentation right now. There are a lot of people trying to solve different problems, and it's a little difficult to bring it all together, or you don't want to have 18 different accounts. And so looking to see where different platforms consolidate a few different options would probably be your best bet, so that you're not having to monitor a few different things or many different things. And so because then it just becomes more work. And so you don't want that. And I know with HeroGeneration, we've tried to bring in a lot of tools all into one place. And so, I would recommend seeing before you jump into anything, does it overlap with something I'm already using, or can I consolidate? And that's just really, because you don't want this to not make your life easier. The goal is to make your life easier, right? So those would be my recommendations. So just to kind of wrap it all up, again, I can't stress enough that this is not about replacing human interaction or, with machines or technology. It really is about giving people back time, presence, really peace of mind. And in your evaluation of tech, I really would just think about those things. Like, is this giving me back my time? Is this giving me peace of mind? And that's really what it should be. And, again, a lot of people in this ecosystem are really coming from a place of empathy. Either they've been through caregiving themselves, or they understand they have a family member, a friend going through it and can see a solution. And so, I think that if we get this right, the future will offload these tasks that just grind on us and grate on us, paperwork and phone calls, et cetera, and should open us up for more of that human connection with our loved one. And that should be the goal. And that should be, when you evaluate what is the outcome in anything that you decide to work with. So That I think is all. And as I mentioned, we would love to offer 1 year free of Hero Generation to anybody in the Lisa's Care Connection universe, the audience, because we are really, building a platform for caregivers to support caregivers, and you'll be receiving an email with instructions on how to activate that. But really at the end of the day, Hero Generation helps you keep all your loved ones information all in one place, collaborate with team members. You can create to-dos. You can, in fact, I will quickly show the platform. So this is after you've signed up and you've gone through the onboarding process. You'll have on your dashboard upcoming tasks that are needing to be done. You can see when you've invited team members, you can assign these tasks to other team members, see what's upcoming, see what may be overdue. Uncle Paul has not picked up my mom's groceries. So Uncle Paul, let's get on that. Things that are due today, upcoming. And then also just keeping all your loved ones' information all in one place. I think this is really goes to that peace of mind, just knowing when something happens, you have all the info so you can see insurance, active conditions, allergies, healthcare professionals, legal documents, etc., all in one place. But I won't go too in depth here. We do have some great onboarding videos. I'm happy to do, as I mentioned with Lisa's Care Connection, we may do a separate event just about Hero Generation for those of you who want to take advantage of this. But again, as I mentioned, everybody in the ecosystem, ourselves included, just really want to provide a better experience and open up the pathways for richer relationships with your loved ones. And so we hope to do that. And we look forward to connecting on Hero Generation and in the future. And any other questions that anybody has about any of this tech, I'm happy to answer now.
Thank you so much, Nicole. I think I speak for everyone when I say how fantastic that presentation was. Looking forward to our community being able to access your wonderful platform. Two quick announcements regarding Lisa's Care Connection. One is that we have Caregiver Spa Day coming up. So we're partnering with fellow nonprofit Beauty Bus, and they give free spa treatments to caregivers and their loved ones who are being cared. They have great professionals from the community doing everything like manicures, facials, hair. Nicole, I think you were at the last one, right?
I was. It's amazing. It is so amazing. They are wonderful.
So that will be on Monday, November 10th at the hospital, Providence St. Joseph Medical Center. We'll be having it in the big conference room there, anytime from 11 a.m. to 2 p.m. And then I also want to shout out the next webinar that we'll be having on November 5th with the lovely Monica Smith from Senior Care Authority, and that'll be on aging driving safety. So one of the biggest questions we have and that we get from community members is it safe for my loved one to drive? And if it's not, how do I go about having that conversation with them? So definitely one to keep on your radar. If you have any other questions, feel free to email myself or Nicole. We'll be sending out a recording of this video along with instructions of how you can access Hero Generation for a year free. Thanks so much, everyone. Take care.